Good afternoon, and thank you so much for joining us for this week's Thursday with AARP Wisconsin show. I'm Amber Miller, your host. And of course, before we get to our guest, just as a friendly reminder, please visit the AARP Wisconsin website for information about upcoming events, volunteer opportunities, advocacy, Medicare, Social Security, anything that you could think of related to AARP will be found at aarp.org/WI. Also, remember the Community Connections initiative that launched last year. If you're to go onto the website, you'll see a couple things. One is volunteer opportunities within your area to help your neighborhood, or you could create your own volunteer opportunities. So getting a group together and maybe doing neighborhood cleanup. There's also the AARP Friendly Voice initiative, which is free. You do not need to be a member of AARP, and it's also open to any age, but you could put a request in for yourself or for your loved one to receive a phone call from one of our AARP trained volunteers, because sometimes we know it's just really nice to hear a voice on the other end. So you could go to the website below, which is aarpcommunityconnections.org, or by calling 1-888-281-0145. And even though we are in a virtual world, we're always looking for great volunteers to join our AARP volunteer family. So if you're interested to learn more, look at reviewing the opportunities, you can go to the website below, which is aarp.org/I want to volunteer. And if there is an opportunity that looks of interest to you, you could fill out the application and one of AARP Wisconsin staff members will get back to you. If perchance you do not remember this website, you can always once again check back at the AARP Wisconsin page. So today, of course, is one of those gloomy days, depending on where you are in Wisconsin, but we definitely want to highlight that today is National Rural Health Day, which is an opportunity to celebrate the power of the rural community by honoring the selfless, community-minded spirit that prevails in rural America. So today we're joined by Alison Page, who is the CEO of Western Wisconsin Health, which is a comprehensive health and medical service organization based in Baldwin, Wisconsin. And we also have Joanne Preston, who is the Workforce and Organizational Development Senior Manager with Rural Wisconsin Health Cooperative, also known as RWHC. I have to get better at acronyms. So I want to thank you, ladies, so much for being here with us today.
It's our pleasure.
And if you are viewing this live, you can definitely ask any questions, or if you have comments, if you're on our facebook.com page, you can put them below or on the YouTube page. If you are watching this in replay, we of course encourage you to still ask questions and we will make sure that we respond to them. So Alison, I'll start with you. So what is great about rural health care in the state of Wisconsin?
Well, I think Wisconsin in particular across the nation is very, very lucky to have such exceptional rural health care. And there are so many good things about it, I frankly don't know where to start. The basic goal, though, with rural health care is to provide exceptional healthcare services and wellness services very close to home. So offering services where people are, where people live. And we do that in Wisconsin very, very well. But beyond that, what we are is really that, like we say, we're going to be your first stop and best partner for the healthcare you need. A lot of times people don't know what's wrong with them, and they stop in or they come to their primary care provider in a rural health center. And almost all the rural health organizations in Wisconsin have connectivity into referral into larger, tertiary care centers. If you're, for example, if you're having a stroke in a rural area, we deliver that life-saving care, and we have recently. We deliver that life-saving care, and then we get you to where you need to be to have that clot sucked out so you don't have permanent brain damage. And we do that, and we do it very, very well. So I think it's those, what's great about it, it's the accessibility, the availability, and the quality of the care is really good in the state of Wisconsin.
And Alison, I know we're talking about the greatness, and I know we actually talked, you and Joanne yesterday a little bit about, because I live in the city of Milwaukee, where I think, I can walk any which way and there's a health center. So I was like, oh, that's kind of interesting to look at it from the perspective of people who maybe don't have as many selections of healthcare facilities. I think I mentioned my dad lives in Juneau, and he ends up driving, I think, up to the Mayo Clinic because of his cancer. And I just find it interesting when he talks about his healthcare. So we talked about how great it was. So what are some of the key challenges in the rural communities, especially related to COVID? And I know COVID has been a hot topic for almost the past 2 years now.
Sure. So maybe I'll just speak kind of generally, and then talk about COVID. I think generally there is a difference in healthcare in urban areas and healthcare in rural areas. In rural areas, and there's a difference in the health of people in urban areas versus rural areas. In rural areas, there tends to be a little higher level of diabetes, for example, of health, cardiac issues, obesity. So there's those underlying things. You might have a different, a lower socioeconomic, lower access to really good food. So things like that are infrastructure things that promote health and wellness might be in some ways lacking in rural areas compared to urban areas. So you have that going on. And then when you look at the access to healthcare, there may be some challenges there. For example, most little towns like the town I'm sitting in, there's no taxi service, there's no bus system. We run a free van service to bring people here, and our next fundraising effort is really now to buy a van that has wheelchair accessibility, because we have a lot of people who are in a wheelchair and it may be expensive for them to get a ride, or inconvenient, or they can't match up the ride service at the same time that their appointment is. There's all those kinds of things. Telehealth is great, but it's not great if I don't have good internet access. So how do I get access to all these things that allow me to live my healthiest life? Very, very challenging. So there is a difference when you look at rural versus urban, just in health in general. Then when you bring COVID into it, there are multiple factors going on there. And we know that things are different in rural versus urban. The cases of COVID in rural versus urban, higher in rural. We have more cases. The mortality with COVID is higher in the rural areas than it is in the urban areas. And why is that happening? Well, if you dig into it and you look at the reasons, it has to do with hesitancy. There's a higher level of hesitancy in the rural area to believe that the pandemic is real. There's lower compliance or lower buy-in, I would say, to the public health measures to prevent the spread of COVID-19 in rural areas versus urban. In urban, you have a higher level of buy-in to those public health measures than in rural. And then too, with the vaccination, we know that the vaccination rates in rural areas are about 10 percentage points behind the vaccination rates in urban areas. So, for example, I live in the rural area, and if you walk into a lot of the stores here, or even I had to go to the Mall of America for something last weekend, and I would say I guessed about 10% of the people in the Mall of America, which was packed, who had masks on. Now that's in an urban area, but it's, a lot of people coming in from all over the place. If you go into New York City, which I was in New York City just not long ago, if you walk into a store in New York City, you will have a mask on, and they will tell you to leave if you don't have a mask on. And so it's a very different in rural and urban. Restaurants out here, you wouldn't know there was a pandemic happening, period. So you have that difference that's going on. I think it's really, that's at the core of it, is the hesitancy is just higher. And again, lots of reasons for that. So we're seeing higher rates. I was just saying before we went live that small hospitals are packed. We have 2 patients here right now and no place to send them. And we're overflowing, and it's bad. It's really the rates of COVID-19 are very, very high here.
And Alison, before we do have a couple of questions that came up through our viewers, I do just want to tell our viewers that AARP does believe that all eligible Americans should get vaccinated to protect themselves and their loved ones to end this pandemic. once and for all. And we do encourage our viewers to, of course, visit the AARP website for additional information on the vaccine and the boosters. So I just want to point that out. So we did receive a question from Jim Flaherty. He goes, will the expansion of broadband high-speed internet in the new infrastructure
Uh-oh, did I just freeze?
I think she
No,
froze.
I think we've lost Amber. I'm going to jump in here to
Sure.
to fill in here. So the question is, will the expansion of broadband high-speed internet in the new infrastructure law create more opportunities for telehealth in rural areas of Wisconsin that previously had limited access to the service?
Right. Well, first we should say there has been a lot done. There has been a ton done to expand access to internet service in the state of Wisconsin, and rural areas are incredibly grateful for the attempts that have been made to do that. But I don't know exactly what's in the infrastructure bill, but I am hopeful that it will. Things like telehealth for behavioral health for us has been huge. We are forming a partnership with Hazleton around substance use disorder to provide substance use disorder intensive outpatient services to people through our critical access hospital and our rural health clinic. Some of these things can be done very successfully through telehealth. And what they found, like the research at Hazleton with substance use disorder, is great success in working with people and helping people get the care that they need remotely if they have good internet service. Lots of people, especially in rural, lower socioeconomic, do have transportation issues.
And I will mention, I just had internet issues, and I'm in the city of Milwaukee. So it can happen at any part, but thank you so much. And then Alison, it looks like we just have one more question for you. So from Sam. So it's my perception that the rural hospitals and clinics really serve as more than just healthcare providers in their communities. I'm thinking of them as a community like health educators. Can you speak to some of the roles that the rural health providers serve?
Yeah, and Sam, I'm so glad you asked that question, because it is so true. In a rural community, the hospital isn't just the hospital. It's a cornerstone of the fiber of the community. We employ like 400 people here. We are not just a hospital by any shake of the stick. We have all kinds of services here. We are the behavioral health program in the schools in the area. We are out in the community. We partner with the community. I think I speak for many, many rural communities across the state of Wisconsin when I say without the hospital, there would just be a major hole in the heart of the community. So we're here, and we try to respond if any issues that come up in the community, if people want information on things, we are here. And so thanks for asking that question, Sam.
Great. Thank you so much, Alison. And thank you so much, Jim and Sam, for your questions. So Joanne, I know you will be playing a short video, and we know that the holidays are coming up, and even before this show with us just kind of talking about kind of what's going on in the state of Wisconsin, having those kind of conversations sometimes can be, very difficult. So we know that there really isn't much of a difference between urban and rural. We were kind of talking about how there's similar issues within the communities. So when we think about the holidays approaching, and what kind of advice could you give to us for having those kind of family conversations about healthcare and what's going on in our state?
Sure. Thanks, Amber. There's a lot of things that we can do to have better conversations. And I'm not here to say that every conversation is one that you should have, but if you do decide to get into some of the hot topic issues, there are definitely some tools and skills. And I think urban or rural, and I'll give a lot of credit to Alison, was just at her organization recently talking about how to resolve conflict. In organizational life, it matters. In our personal life, it matters too. And so, the first place to start is to not go into these conversations expecting to be right or expecting to win someone over. I mean, think about your own times that you are influenced. Are you influenced by somebody saying to you, here's what you ought to think? It doesn't influence people. So especially as we talk about COVID, I think these are really difficult conversations, but they start from a place of understanding, seeking first to understand. And I think it'd be a good place to pop up that 30-second video that we are doing with the Healthy Wisconsin Alliance partnership to do a Stop the Spread. And I think this video will speak, and then I will be happy to follow up after she speaks.
It's been over a year, and I was tired of hearing about COVID. I wasn't vaccinated, and I didn't always wear a mask when I should. I thought if I ever did get COVID, I'd be fine. I was wrong. Over the summer, COVID put me in the hospital for over a month. I faced the reality I might die, but luckily I survived. I made the mistake, but you don't have to. The vaccine is safe, effective, and free. Please don't wait. Vaccinate.
So as you can see, it's making it a point from advocacy, but it's from a place of speaking to people who are probably more like-minded. And I think that's the place where we need to start is to realize that there's a time for advocacy, making your point, and there's a time for more inquiry. So some of the tips that I would share would start with, if you want to have this conversation, is help me understand your point of view. I'm interested in how you came to believe what you believe about this. So starting with a question, help me understand, or I want to see things from your point of view. I think a second point I would make is, start with your heart in the right place, that you're not going to necessarily have a goal of winning someone over. I mean, you hope that you do, but the goal is to get to a place where you can hear each other. That's the game changer there, is when we can start to really hear each other, just like this woman in the video is going to relate to some people who might not have heard a different kind of message. Another tip that I would share is really focusing on listening. I think listening is a skill that is part of a communication skill that most of us don't do very well at it. And, we're waiting for our turn to talk, or we're thinking about what we're going to say, and we stop listening. So we really want to ask and then listen. Listening includes being willing to say, here's what I understood from what you said. Is that right? Instead of just like waiting for your turn to have your say. So really pausing and listening and being present, even if that's your only goal, is just to listen. I would share with listeners too, there's another technique we talk about in conflict resolution. It's called the don't do technique. The way it works is you think about, if you're going to have a conversation, what is the thing that person is going to get defensive about? So let's say I'm going to have a conversation with someone about vaccines, and I want to convince them, but I want to start by saying, what I don't want is for you to think that I believe you don't care about your health. Because sometimes when we have these conversations, it comes off like, I care about my health and I care about people, but you don't. And that's a non-starter. So starting out with, I don't want you to feel like I think you don't care about your health. I believe that you do. What I do want is to have a conversation so that we could try to understand each other better, where we're coming from, and see if we can find some common ground. Now, this takes a little bit of time, but it's time well spent. What's the alternative? Is that we just argue or put our opinions out there on social media, and not have a real dialogue to where we can get to a place of understanding. So those are just a couple of tips. I've got more, and I'm interested if you have a question or thought about that.
And I do know, if you're watching this live, there will be some websites that are going to be attached to this interview. So if you're wanting some more information, Joanne, maybe you could talk about the blog.
Sure. I write a monthly leadership blog, and leadership is, in my definition, is about having influence. It's not necessarily a position as manager or CEO. It could be, and it should be, but it's also just about our own personal leadership. So tying back to our conversations about families is, how do I want to show up at this holiday event, and who's the person that I want to be in this? So thinking about that. But the blog is, it's a monthly blog that I put out. It's on our website, rwhc.com. And it comes out every month. It's on different topics that leaders are talking about and struggling with, and conflict comes up just about every day, and communication skills. So these are really important issues that we just have to practice to get better at. I think it's also helpful to practice when you think about these conversations. I know a couple of conversations that I can get into and I can pretty much press play because I know what's going to happen. So I need to be ready for that. I need to be ready to decide, what is my choice if these things happen? What am I going to do and say? How am I going to manage myself? And also, if I can I love this phrase, stay curious, not furious. Stay curious, not furious. When I start to feel those emotions rise up, to pause and think, how could I just stay curious about this person? And, I honestly believe that at the end of the day, we have a lot more in common than we don't. And I really go back to this regularly because I believe that people want good things. I want good health. I think you do too. I want to feel safe. I think you do too. I want my family to have what it needs for healthcare, for independence, to be autonomous. I think you do too. So how can we start finding some of that common ground and start to build incrementally from there?
Absolutely. And Alison, I have one final question for you. This might be the first time people have heard or even knew that today is National Rural Healthcare Day. So for our viewers, what would something that you would want them to remember about this day or to keep in mind about the healthcare within the state of Wisconsin?
I would speak to rural healthcare nationally. I would say the message for people is don't take it for granted. Don't take rural healthcare for granted. There was a time in this country in the early 80s when there was a lot of competition in healthcare. There still is a lot of competition in healthcare, but if not for the federal government coming in and establishing something called critical access hospitals at that time and helping to fund hospitals in rural areas to keep them alive when it's a little bit complicated, but the way the federal government was paying for Medicare to hospitals shifted in the early 80s. And if the federal government hadn't stepped in and said, you know what, we're going to create a safety net program to ensure that hospitals in rural areas can continue to survive and thrive. We're going to help fund them, even though their volumes are low. That has created a wonderful, wonderful asset for rural communities through our critical access hospital and our rural health clinic designations. And so I would just say to people, don't take it for granted. Use your local institutions, put confidence in them, support them, because if they're not there that day that you have the heart attack or you have the stroke out in the farm field, they won't be there for you. And we need them. We need them. They're absolutely critical to our great way of life in Wisconsin.
Great. I want to thank you, Joanne and Alison, for being here today. I definitely encourage you to visit the website that Joanne was talking about to have these, difficult conversations that maybe aren't even around the holidays. It could be any day, but I definitely think being able to have those conversations and being an active listener, I think is a really good first step. So please visit that information at the website that just popped up. And thank you, ladies, so much. We really appreciate you being here today.
It's a pleasure. Thank you.
Thank you, Amber. Bye-bye.
Thank you. And as always, we love to talk about some upcoming events. All right. So this Friday, tomorrow, Movies for Grown-Ups, the screening of Atonement. Hopefully that's right. Tuesday, the 23rd, Gourmet Tour of Italy, the Food Historian Lecture. Monday, the 29th at 3 p.m., you can learn about exercising with Qigong, which is like meditation. So you can learn more about that. Tuesday, November 30th, Social Security Retirement, your questions answered. And then December 1st, lecture, A Brief History of Classic Television, which I think that looks super interesting. So if any of these are ones that look of interest to you, we encourage you to go to the website below, or please call the phone number 1-877-926-8300. Please also remember the Small Dollar Big Impact application is due December 8th. If you have a creative, innovative idea that would bring impact to your community, and you happen to be a nonprofit or a municipality, we encourage you to visit the website below, which will give you more information about the grant, which is up to $1,000. And then you can also fill out the application. So once again, that is Wednesday, December 8th is when that application is due. So next Thursday is Thanksgiving. So we will be taking the week off, but we hope that you come back here December 2nd to learn, actually December, well, it's a week, but we're going to call it a month. It's Older Driver Safety Month with Neil McCollum, who leads our efforts with our driver safety program. So come back here December 2nd and we'll be talking to Neil. He always has such really great information, and we know with winter coming up, getting some more tips and tricks on how to be a safe driver is always helpful. So I very much thank you for being here with us today. Please always remember to visit the AARP Wisconsin website should you have additional questions regarding the COVID vaccine or the booster shot. And we look forward to seeing you December 2nd. And until then, be safe.